And then, of course, big news, lots of discussion about is the rollout of vaccines for children between the ages of 5 and 11 years old. So a couple of reminders. This is the Pfizer vaccine that has been approved and licensed for use in Canada by Health Canada for children aged 5 to 11. The vaccine is a smaller dose, so the pediatric or children's dose of vaccine is 10 micrograms compared to the 12 and over dose, which is 30 micrograms. It has a slightly different buffer than the adult dose, which is actually improved some of the transportability and storage of the pediatric or the children's vaccine. In terms of rollout in Haliburton, Kawartha, Pine Ridge, so the province, we received vaccine late at the end of last week. Our first booked appointments were available starting Monday of this week. And as of this morning, over 1,000 residents aged 5 to 11 and residents of Haliburton, Kawartha, Pine Ridge District Health Unit had already received their first dose of COVID-19 vaccine, which is really, really exciting news. Families and children are able to access COVID-19 vaccine through a number of different ways. One way is at health unit-led vaccine clinics. You can book an appointment for these vaccine clinics on the provincial booking system. There are over 8,000 appointments available for children aged 5 to 11 throughout the month of December. We know that right now there's over 2,000 appointments that are currently booked. And so there's still a significant number of appointments that are open and available for children and families to access vaccine throughout the month of December. In addition, there's many primary care practices that are also offering COVID-19 vaccine. In particular, in Northumberland County, we know a number of the family health teams, as well as community health centers, are offering vaccine clinics for their pediatric population or for the population aged 5 to 11. Also, there's at least 16 pharmacies across all of HKPR jurisdiction that are also offering the COVID-19 vaccine for children aged 5 to 11, and so parents and guardians can connect with their local pharmacy to determine whether or not that's the channel that they would like to receive vaccine. Many different ways to access vaccine. I think the other key thing to note is there's a lot of questions. I think a lot of information circulating on the internet, on social media about COVID-19 vaccination for children. I think it's normal for parents, guardians to have questions about newer products for children. And parents and guardians want what's best for their children and want to keep children safe and healthy. There are a number of sources that have very good information about COVID-19 vaccine in children, about its safety, about how well it works. This includes many resources listed through our website that might connect you to resources from the Hospital for Sick Children, the Canadian Pediatric Society, the pediatric section of the Ontario Medical Association. All have developed really, I think, thorough and thoughtful resources that provide information about COVID-19 vaccine in children. So for parents that have questions, I'd encourage you to connect with your trusted healthcare providers and to speak with them, to visit sites on the internet, and of course, sites on the internet that are linked with some of these public health resources or pediatric society resources. And then, of course, the health unit is hosting a panel discussion tomorrow evening, December the 2nd, on COVID-19 vaccine in children aged 5 to 11. So myself will be on the panel, two local family physicians, as well as one of the public health nurses from our team at HKPR. We'll be talking about the safety data behind the vaccine, efficacy data behind the vaccine, different strategies we can use to help children in receiving vaccine and making sure that it's a safe and positive experience for everyone that's involved.